Hello everyone, this is Dr. Vinit Kumar Rai. You are welcome on my YouTube channel Capsule. In today's lecture, I'll discuss about the introduction part of the Biopharmaceutics and Pharmacokinetics. As you all know that the origin of the most of the drugs which we consume are plant, animal, mineral and chemical synthesis. And we cannot consume these drugs as such. So drugs are rarely administered in pure form. Therefore, the drugs and some excipient and so-called inert substances are mixed together to form dosage form, and dosage forms are administered by a suitable route. After administration of the dosage form, they give therapeutic responses, um, and therapeutic response is not an attribute of drug intrinsic pharmacological activity. It is a combined effect of drug as well as excipients. So the dose-response relationship for oral, parenteral and other routes are not the same. It will be different when the route of administration will be changed and dosage form will be changed. The observed variations are seen with when the same drug is administered as different dosage forms, the similar dosage form produced by different manufacturers, the physicochemical properties of the drug, the excipient present in the dosage form, method of formulation and manner of administration. All these things will govern the variation in the dosage form, and you can say the dose response relationship. When we vary these parameters, then the dose response relationship will be changed. Therefore, the concept of biopharmaceutics has come into the existence. To study these variations, we study the biopharmaceutics. Different definitions associated with the biopharmaceutics and pharmacokinetics are biopharmaceutics, that is the study of factor influencing the rate and amount of drug that reaches to the systemic circulation. We study the factors, different factors, as we have discussed in the previous slide. These factors are studied in biopharmaceutics. Absorption is another term, that is the process of movement of drug from its site of administration to the systemic circulation. Next one is bioavailability. It is defined as the rate and extent of drug absorption. Both rate and extent are important in this particular term, and any alteration in the drug's bioavailability is reflected as the change in pharmacological effect. Concentration of the drug in plasma, the onset of action and the intensity and duration of responses depend upon the bioavailability. Obviously, these terms will be affected when the bioavailability will be changed. Now, then distribution and elimination together are known as drug disposition. When drug disposition is a combined term for distribution and elimination. Distribution is the movement of drug between blood and extravascular tissue and from extravascular tissue to blood. The onset, intensity and duration of action depends on the distribution behavior of the drug and the time period for which the effective concentration is maintained. It depends on the extent as well as time, both onset of action, intensity and duration. The next term is elimination. It is defined as the process that tends to remove the drug from the body, and it includes both biotransformation and excretion. So it is a combined term of biotransformation and excretion. Now, pharmacokinetic. What is pharmacokinetic? It is defined as the study of time course of ADME. ADME means absorption, distribution, metabolism and excretion. It is defined as the time course of ADME and their relationship with therapeutic and toxic effect of the drug. So ADME, sometimes known as KADME, that means kinetics of ADME. Clinical pharmacokinetics. It is used for the pharmacokinetic principle in optimizing the drug doses to suit individual patient need and achieving maximum therapeutic utility. So the pharmacokinetic investigation, when we use this investigation for the clinical purpose, it is known as clinical pharmacokinetics. Now coming to the pharmacokinetic processes. What are the different processes involved in the pharmacokinetic study? It deals with the disposition and absorption of the drug. As you all know that the pharmacokinetic deals with the absorption, distribution, metabolism and excretion. So there are two terms, absorption and disposition, are written here, and disposition includes the distribution as well as elimination of the drug. And finally, elimination deals with the metabolism and excretion of the drug. So there are four terms: absorption, distribution, metabolism and excretion, and all these terms together known as pharmacokinetic parameters. And you can see here the dosage form, solid unit dosage form, that releases the drug, and the drug distributed into the blood, and then drug goes to the extravascular tissues, and then it comes from the extravascular tissue to the blood also, and it is the reversible process. And finally the drug will go to the liver also for metabolism and biotransformation, and it can directly it can directly go to the excretion process also. So these processes, when combined together, are known as pharmacokinetic processes. Now, what is the drug development process? It contains four phases. First phase is the pharmaceutical phase, and it deals with the physicochemical properties of the drug. The physicochemical properties of the drug is studied, and the next one is design and manufacture of an effective product. So these two steps are involved in the pharmaceutical phase. Next phase is pharmacokinetic phase. It deals with the ADME study of the drug as shown by the plasma drug concentration time profile, its relationship with the dose, dosage form and frequency and route of administration, and it tells what body does to the drug. Okay, so it tells about the different physicochemical changes in the drug's physicochemical properties by the body. So the next one is the pharmacodynamic phase, and it is the biochemical and physiological effect of the drug and its mechanism of action. And the next one is the concentration of drug at the site of action, and based on the concentration of the drug at the site of action, the pharmacological action is ensued, and its relation to the magnitude of effect observed. Obviously, the amount of drug which is getting available at the site of action, that decides the pharmacological effect of the drug. If the concentration of the drug is low, then it will lead to the subtherapeutic effect, and if the concentration is very high, then it may lead to the toxic effect of the drug. Next one is the therapeutic phase, that is concerned with the translation of pharmacological effect into the clinical benefits. So these are the four processes or phases involved in the drug development process. Now you can see here the different four phases in the flow diagram. You can see here the drug plus excipient makes a dosage form, and dosage form releases the drug, dissolve the drug, and drug goes to the systemic circulation, and then it goes to the site of action, and then with a reversible process it can come to the blood also, and after site of action the drug gives the pharmacological response and therapeutic effect is observed. So The drug and excipients are combined together to and that is the process of formulation development. And if drug is not released, then the dosage form will not be effective. And if the released drug is metabolized or excreted, here you can see, so it will lead to, okay, if the drug is released and getting metabolized extensively, then it will not lead to any therapeutic effect. So after getting released at the release site, the drug gets absorbed into the systemic circulation, you can see here, and finally from the blood the disposition process occurs, and disposition process lead to the distribution of the drug as well as elimination of the drug. And drug at the site of action, finally after producing the pharmacological response, it may go to the metabolism or excretion process. So if you can see here the oral route of administration, it is true for oral route, and if it is parenteral dosage form, then it may directly go to the systemic circulation, because there is no such phases like absorption in the case of parenteral dosage form. It directly injected into the blood or systemic circulation. So when dosage form development as well as producing dosage form, and both the steps are combined together, and these terms are studied in pharmaceutics. Then drug release process, drug into the systemic circulation, and drug at the site of action. All these steps are studied in pharmacokinetics study. Then after getting available at the site of action, the drug produces pharmacological response. That the study of the study of pharmacological response is known as pharmacodynamics, and the study of therapeutic effect is known as pharmacotherapeutics. And biopharmaceutics mainly involves the dosage form development, drug release, and drug in systemic circulation. At the same time, the clinical pharmacokinetics involve the drug release process, drug in systemic circulation, drug at the site of action, pharmacological response, and therapeutic effect or toxic effect. So all these steps are involved in clinical pharmacokinetics. So finally, the product should deliver API at an optimal rate and amount to produce any pharmacological effect, and knowledge of the factors affecting the viability helps in designing an optimum formulation. And the knowledge and concept of biopharmaceutics and pharmacokinetics have an integral role in designing and development of new drug and their dosage form and improvement. So this is all about the introduction of biopharmaceutics and pharmacokinetics. So in my next video, I'll be discussing about the absorption of the drug. So thank you everyone for watching this video. Bye for now.